My name is Smith Bailey.
My name is Jacob McCauley.
And this is our Tay Sachs Awareness Project, where we created the organization HEXA to shed light on this devastating and incurable disease.
It's a rare inherited neurodegenerative disorder.
This disease is a genetic disorder that affects the nervous system. This causes nerve cells in the brain and spinal cord to die. Over time, this leads to seizures, vision and hearing loss, paralysis, and other major issues. Tay Sachs disease is caused by mutations in the HEXA gene on chromosome 15, leading to the absence or dysfunction of the enzyme HEXA. Genetic disorder inherited in an autosomal recessive pattern, meaning both copies of the gene must be mutated for the disease to develop. It follows a predictable Mendelian inheritance pattern. For example, if both parents are carriers, each with a normal and a faulty HEXA gene, there's a 25% chance the offspring will receive 2 mutated HEXA genes, which would mean that the child has Tay Sachs disease. There is a 50% chance the child will receive 1 mutated HEXA gene and 1 normal HEXA gene. This would lead to them being a carrier. Lastly, there's a 25% chance the child would inherit 2 normal HEXA genes, which would mean the child is not affected and is not a carrier.
HEXA gene is copied and passed to offspring. Errors in this process can cause mutations such as point mutations, single base substitutions. A small mistake during DNA replication meiosis can lead to a single nucleotide change that disrupts the HEXA enzyme function. It can also cause frameshift mutations, which are insertions or deletions. Errors in meiosis can add or remove DNA bases, shifting the genetic code and producing a non-functional enzyme. Example, 4-base pair insertion, TATC, in exon 11, causing premature termination of HEXA production. 3. Splicing mutations. Mutations that affect RNA splicing lead to improperly processed HEXA mRNA, preventing correct enzyme formation.
The gene mutation prevents the production of a functional HEXA enzyme. Without HEXA, GM2 gangliosides cannot be broken down properly, as GM2 gangliosides continue to accumulate in lysosomes. Nerve cells lose function and die, causing the brain and nerve cells slowly get damaged and stop working over time.
This primarily affects the brain and nervous system, leading to severe physical and mental decline. Symptoms do not appear immediately, but the infant typically gets worse very quickly. Around 3 to 6 months, developmental decay, muscle weakness, and the loss of motor skills are typically found. By 12 months, increased muscle stiffness, vision and hearing loss, and seizures. Another key symptom of Tay Sachs is a cherry red spot in the retina, a key diagnostic feature seen in most cases. Severe brain atrophy leads to the paralysis, loss of swallowing ability, and respiratory failure.
Lifespan is typically between 3 and 5 years. Some effects in the quality of life include rapid decline in motor skills, vision, and hearing. In addition, severe muscle weakness, paralysis, and seizures severely limit movement and independence. Also, feeding tubes and respiratory support are often needed. Furthermore, children become completely dependent on caregivers and require constant medical attention. Lastly, quality of life is severely impacted due to physical and cognitive decline.
In many ways, Tay Sachs disease can be diagnosed. These can include genetic testing. DNA analysis can identify mutations in the HEXA gene on chromosome 15. This test can confirm the diagnosis in symptomatic individuals and identifies carriers. Another form of testing is enzyme testing. A blood or tissue sample is taken to measure the activity of the HEXA enzyme. Individuals with Tay Sachs have little to no HEXA activity. This test can differentiate between affected individuals, carriers, and those without the mutation. The last form of testing is an eye exam. The ophthalmologist may detect a characteristic cherry red spot in the retina, which is a sign of Tay Sachs disease.
Available. There is currently no cure for Tay Sachs disease, but treatment focuses on managing symptoms and improving quality of life. Available treatments include supportive care, such as medication for symptoms, which include anti-seizure drugs to help control seizures, muscle relaxants to ease unusual tightness and stiffness. Quality of life can also be improved through nutrition and feeding support. This can include feeding tubes, which may be used if swallowing becomes difficult, and high-calorie diets can help maintain weight. In addition, respiratory care is important. Using chest physiotherapy helps clear mucus buildup and prevent infections. In later stages, mechanical ventilation may be needed. Furthermore, physical and occupational therapy is important as it helps maintain movement and prevent muscle stiffness, while also improving comfort and daily function.
Information includes Tay Sachs is most common in Ashkenazi Jewish population. There are many forms of Tay Sachs. However, infantile Tay Sachs is the most common and severe. In the general population, only 1 in 1 million people are born with Tay Sachs disease. A simple blood test can identify carriers of the HEXA gene mutation. Research is ongoing to develop potential treatments, including gene therapy and enzyme replacement therapy. However, at this point, Tay Sachs is always fatal. This is why we need your help and why we created HEXA Hope to give hope for HEXA.
References we used.
HEXA Hope out.